All right. And so, of course, as you all may know, as the collaborative for advancing health equity and out of school time, we are partnering with NAA, National After School Association, and we are working to improve the health and well-being of youth and staff and out of school time programs, with a particular focus on groups that have been marginalized and are at the most impacted by health disparities. So again, thank you so much for joining our virtual institute. And so as we jump into our session today, let's take some time to discuss the foundation, the basics. Oh, I'm sorry, wait, I didn't introduce the rest of the team here. If we could go back one slide, that'd be greatly appreciated. I need to introduce the team. I would like if you are part of the CAHE/OST team, please feel free to introduce yourself and just say your name and how you support this work.
Hey everyone, this is Kate Goddard. I'm the project director for the Collaborative for Advancing Health Equity and Out of School Time and actively posting in the chat. So great to be here with all of you.
Hi, I'm Claire Grace Jones. I go by Claire Grace. I'm a training and technical assistance associate here on the project, and I'm really excited to be bringing you some information from the assessment to action guide that we've created today.
Welcome, everyone. Great to see some faces from before. I'm Nadia Foster. I also provide technical assistance on the OST team. Welcome.
Heidi, would you like to introduce yourself?
Sure. I'm Heidi Ham from the National After School Association, and it's great to be here with you all and see you interested in this topic.
Yes, thank you. I think and we also have Anna, who is our TA, supporting us as well for this session. And, talking about excitement, I apologize for overskipping my team, but it's impossible to do this without them. So thank you all so much for joining us and being a great team to work with and present this information. So let's get into it. Health equity, what is it? So in this slide, we'll be talking about what is health equity. We hear this term constantly, but what does it actually mean? And so when we talk about health equity, we're focusing on the fact that everyone has a fair and just opportunity to be as healthy as possible. Now, this works by focusing on ongoing societal efforts to address historical and contemporary injustices, overcome economic, social, and other obstacles to health and healthcare, and eliminate preventable health disparities. So again, when we're talking about equity, this is really focusing on how do we make sure everyone is able to receive the appropriate resources that we all deserve. And so throughout our session today, we're going to be talking about how we can be advancing health equity within OST. And so our objectives for our institute are actually quite simple. We want to make sure that folks are able to build equity considerations into planning and implementing HEPA standards. And so we'll make sure we'll go over those standards today. We also want to make sure that folks are able to create a team that brings the needed capacity and diverse perspectives. And again, we'll talk a little bit more about what that team looks like, who's involved, and how can you all work together. We'll also make sure to identify and prioritize standards to focus on. If you are new to HEPA standards, they may seem a little bit overwhelming, but please do not worry. This is why we are here. We will be here to really kind of help break down what are some of the things that you can focus on. We also will be implementing or acknowledging barriers and proposing changes to test and address them. And last but not least, we will work with you to create an action plan for implementing the selected and desired HEPA standard that you have chosen. So we are definitely looking forward to a productive time together. All right. So our agenda for today is as follows. We are going to be going over some of the foundational pieces. What are some of the building blocks to this work? We'll also make sure to take some time to go over our assessment to action guide. We'll take time to discuss gathering your team, conducting an assessment, setting those priorities. And then we'll also make sure to dedicate some time to highlight one of our fantastic partners, which is called the Program Spotlight College Street Elementary Gardening Program. So we're definitely looking forward to hearing this recorded interview that took place with this program, and we look forward to sharing these resources as well. So as we begin our session, I'm going to turn it over to my colleague Nadia to talk about what are some of these foundational pieces that help make this work effective. Nadia?
Yes. Thanks so much, Bianca. And thinking about that earlier slide, right? Health equity, advancing health equity. I want us to think about the importance of community, right? Why is it important to understand the identity of the community you serve? What are the stories? What's the history residents carry with them? How are their cultures and experience honored or built into the programming and services that you create? What do you know about the changes that have occurred in the community, whether it be demographical shifts, right? Issues of gentrification, being a gateway city, loss of industry. Understanding the changes, the history will also help you perhaps understand, again, deepen that understanding of the needs of the community. What are ways to sort of explore engaging in dialogue with local leaders, whether formal or informal leaders, longtime residents? How are they defining the most pressing issues? Do they align with what you see? Do they align with perhaps what your school district is prioritizing? How has your community been impacted by natural disasters? I think about Hurricane Katrina, right? And folks having to move in nearby towns, nearby states, whether it be Arkansas or Texas. The wildfires in California and how that's impacted quality of living and quality of health of residents. What is the power system within your community, right? When you think about power systems, political, economic, institutional, social, cultural, who holds the power? How are they also being health equity champions? All of this is data, crucial data, right? And so it helps, again, better understand the needs of students, families, understand why sort of policies exist and whether or not they're benefiting all students. Think about the schools that you work with and work in, right? Data drives a lot of decisions. Think about a curricula that's changed, a shift in curricula, right? The new math seems to happen every 3 years, or the new science. So student outcomes in both sort of standardized tests and as well as how students are faring really drive those changes. We want it to at least drive those changes. Being a champion for health equity is really about understanding not only the assets of your community, but also seeing the value of community members, knowing their realities and being wisdom to find solutions to their problems. It's about operating from a data-driven lens, right? So when I think about data-driven, it's also about those like qualitative pieces that I spoke to earlier, but also engaging with your local community health and needs assessment. If you can go to the next slide, please. Right? What's a community health needs assessment? It's right here, right? It's a comprehensive report on how your community is faring, right? What are the needs? What's sort of the demographical makeup of that community? What are the cultures and languages represented? But also it speaks to understanding the social determinants of health of that community, right? And so it's a really important tool to not only recognize what the health report is for your community, but also creating aha moments of recognizing issues of environmental racism, the limited healthcare access that continues even in our country, that continues to really plague a lot of communities, medical bias, right? When you think about how perhaps cancers are more likely different populations in terms of perhaps Black women with breast cancer, Black men and Latino men with prostate cancer. What is involved in that? Why, again, simple screening, why isn't saving more lives? And also the barriers for residents. How can you lead on ensuring your community health needs assessment is discussed regularly within your school, within your teams? How can you make these reports more accessible to families, right? That is a tool for empowerment, for families to also understand and hear what's being said in these reports. How are they reflected in that compelling data? How can you ensure that your voice as an out-of-school time program leader is also reflected in that report? How are these informing the goals and educational programming? You need to be seen and you need to be heard. If we can go to, please, the example that we have here for community health. So right here, this is for the Berkshires. It's a central part of our state in Massachusetts. And these are some graphs that really show a picture of food insecurity, right? So this should absolutely inform perhaps funding that may go into local food pantries, but perhaps how schools are also designing other resources or ensuring other resources for families who fall into this category of being food insecure, right? How are local hospitals also addressing the needs of greater food access? The other graph speaks to, the mental health and well-being of students, right? How could this inform policy, perhaps, on increasing the number of mental health practitioners and resources within schools or within the local public health department? How could this impact the kind of educational programs for families and community members so they could recognize issues of depression and sadness in young people to lower sort of suicide rates? So with that said, we'll speak to a few more resources and really helping you sort of look to community health needs reports. And thank you for listening.
Thanks, Nadia. Claire Grace, can you go to the next slide? And we'll share some additional resources in the chat and following the session so you can access some of these local resources. And I want to thank Nadia for sharing kind of the broad reason why we're all coming together here and really thinking about health equity as an issue that impacts our communities, but also impacts the youth that we serve and the families that we serve. And but we also want to recognize that many of you on this call, a lot of us come from out of school time. And so what's up on the slide is going to be not a lot of news to you, but we do recognize that OST or out of school time programs really have a long history of ensuring that all youth have access to healthy foods and opportunities for physical activity, that they have a place where they feel safe, that they're engaged in culturally relevant learning activities that are purposeful and intentional, and that they have opportunities to form positive relationships with adults and their peers. And this research tells us that this regular participation in quality out of school time programs has been shown to improve the students' self-confidence, self-awareness, and positive social behaviors. And research has also shown that programs that provide healthy foods and keep kids active is associated with decreasing anxiety and emotional distress and increasing self-esteem. So we knowing that we can make a positive impact on the health and the well-being of the young people we serve or our staff, OST can really build upon the foundations of positive youth development and become strong partners in a system that supports the whole child's health and wellness. Next slide, please, Claire Grace. Thank you. So let's talk about what works. So, you know, we're here, we're coming together to talk about what can I do and what can we do to really help advance health equity and really support our students and young people. And so this month, I'm really excited to share that this month, the CDC published a collection of peer-reviewed articles that present a decade of school-based physical activity and nutrition intervention research conducted across multiple whole school, whole child, whole community components. And the research has been compiled and is presented in a special issue of the Journal of School Health titled The Collection of Evidence-Based Strategies for School Nutrition and Physical Activity. And they have an out-of-school time resource, so a section in their article. And so the findings here on the slide illustrate what they have found as evidence-based strategies in looking at this decades-long look at research. And so just really briefly, you can see it on the slide, but some evidence-based strategies that emerged from this article are around adopting policy changes to make nutritious foods and physical activity routinely available, training staff in how to use ready-made evidence-based programs and curriculum, designing professional development to be responsive and flexible to the out-of-school time staff, partnering with nonprofits, community organizations to deliver out-of-school time program support, and then strengthening relationships between out-of-school time staff and school nutrition professionals. So, so now that we've seen that, Claire Grace, can we go to the next slide? I also want to take a moment and introduce the National After School Association's Healthy Eating and Physical Activity Standards for out-of-school time, what we've been referring to as HEPA and Bianca introduced earlier. And these standards really help support those evidence-based strategies I just shared and translate nutrition and physical activities science into actions you can take to offer healthy foods, beverages, and physical activity in your programs. The standards also address staff training, program culture, policies, program management, and the environment of your physical space. So while these standards are aspirational nature, they are meant to be a guidepost towards which programs should work towards, and programs should feel free to tailor them to their specific context. And that's what we're going to talk about here. So today we're really going to talk about how best to identify the standards and priorities in which you want to work in for your programs over today and in our next training session. And so as the focus of this institute is to provide practical steps and strategies for adopting the standards, we want to do a quick activity to gauge your familiarity with the HEPA standards. So we're going to try this out. We're going to use an annotate tool. If you look at the bottom of your screen above the mute bar, possibly above the video, you're going to want to, you'll see an annotation, like a little pencil. And if you click on it, you'll see a menu pop up, which of course is not working for me right now. Oh, there we go. A menu pops up on the left-hand side of your screen, and there's a couple tools you can use there. And I want to point you out to the stamp tool. It looks like a check mark. You might have a heart there. If you click on that, you can select a stamp of your choice. So for instance, I'm going to choose heart. Take a moment, find a stamp, and then put yourself on the arrow. Are you not familiar with the HEPA standards? You would select on the left, and then if you are already implementing them, put your stamp on the right, and then anywhere in between. We're going to use this tool again, so it's also practice. So great, this is great to see. So we've got a real spectrum of folks, some people coming who are just learning about the HEPA standards, some who seems like there's a critical mass of folks that are familiar with them, and then some that are already implementing them. Great. Well, excellent. Well, let's go ahead and turn this over to Claire Grace, who's going to introduce a new resource and dive into that.
Awesome. Thank you so much, Kate. So I'm Claire Grace, and I am really excited about this resource that we created. We were really thinking about, how do you move thinking about the standards and knowing that you want to implement them to actually all the way through the process into putting them into action. And so we as a project created, sorry, I'm just messing with my screen while I'm talking. I can't multitask. So we as a project created an assessment to action guide. And during today's webinar, we're going to walk you through the first couple of steps of that. We really wanted to make sure throughout the whole process that we were breaking things into small manageable pieces, thinking about how you can use an equity lens and infuse equity throughout all of your decision making. Oops. And so we broke this work all the way from doing your assessment, pulling your team together, to creating your action plans and getting ready to implement. We broke the whole process into 6 steps. And today we're going to focus on the first 4, getting familiar with the tools, gathering your team, completing those assessments as a team, and then identifying and prioritizing where you want to begin your implementation work. So one of the first things that that we encourage folks to do is to explore the 2 assessments that we've identified that we think work really well together, to look at what you're already doing, think about where you want to make some improvements, make sure that you're doing all of that work with an equity lens. And so these are the 2 assessments that we really lean on in the document that kind of infuse all the rest of the work. And I really just recommend that you start by reading the assessment to action guide, getting familiar with the tools, and then that will really help you to think about the next step, which is to gather your team. Even if you already have a strong, diverse team ready to take on this work, we really encourage you to think about, the questions and the prompts. We tried to design the template so it's had lots of templates and just kind of questions to think about and some additional resources. I really encourage you still to utilize this section and just think about who you're really bringing around the table as your both as your core team to be helping you walk each of the steps through this process, as well as then your extended team of partners just in building capacity and sustainability to do this work. Just a note that really having broad and diverse representation on both that core team and that larger group of partners that are, that you're really bringing their voices to the table in doing this work has a lot of benefits. So one is it creates an early feedback loop. Having people at the table that represent the populations that you serve, that bring needed permissions and accessibility and potentially funding and other people from other areas of expertise that we're going to talk about more in just a little bit. Having those people right at your table from the assessment phase all the way through the planning phase really enables to have multiple perspectives to offer to create this early feedback loop that you'll have folks around your table that are able to maybe anticipate that something might not go how you think it's going to go. And before you put time into resources into doing it, it gives you an opportunity to really think about, does this seem like it's going to happen the way that we think it's going to happen? They also can help you if you are running up against things that seem like they're just not going the way that you thought they would go, or you're not, getting the input or the engagement or the participation. You'll have those voices around your table to really help you identify those barriers. What are the whys? What might be behind those? What might be getting in the way? And help you to brainstorm some of the solutions that you can implement and test. I also have found I've worked in the field of prevention and multiple kind of things that touch public health for the last, I think, 17 years now. And capacity building is, for me, always, I think, really this cornerstone that everything else gets built on top of. And another reason for that, I think, is that bringing people to your table early really builds buy-in, an early buy-in. Having people at your table that are helping to look at the tools, understand why you're going through this process, why you're choosing evidence-based strategies, why you might have decided to choose one strategy over another strategy, why it's really important to be connected, doing something in partnership with the school. Having folks at your table when you're planning and looking at things and making those decisions really solidifies that engagement and buy-in when it's time to get needed permissions or bring on a funding for a partner for funding or resources or sharing their expertise. This also builds sustainability. You have folks that are involved in the process that really understand why it's important to be using a process, to be using evidence-based, programs and practices that we know have been studied. And if we implement them the way that they're intended, we can expect to have good outcomes. And we're really kind of getting the most bang for our buck in this way, because we know if we put time and funding into these efforts, we're more likely to get the results that we desire. And again, also having those folks around the table can more readily help you to identify equity considerations. And so when you think about building capacity, often I've worked with a lot of community organizations, community coalitions, a lot of work even with, state level agencies and jurisdictions doing this work. And I think sometimes when we think about who we want around our table, we jump right to the who. Oh, Mary would be a great person to ask, or, oh, I know, Mark has this connection, let's ask him. And I think those are great things to do. But I also encourage really taking a step back and thinking about what are the skills that you really need at that table? What kind of data do you need access to? What kind of resources are you going to need? And to think about those things, who then has access to those? Who can give permission? How does their work align with our work? I was thinking when Nadia was sharing about the community health needs assessments, I've seen those be such an amazing tool to leverage in a community where the community with the work of this public health group, with this partnership, is identifying that maybe, they're concerned about obesity rates and want to think about healthy eating in their community. They're concerned about substance use prevention, and they want to make sure that kids have options to be making healthier choices, or some connection to some evidence-based programming. And agencies that I've worked for have been able to leverage that to say, hey, we do that. If, let's work together and partner to bring kids and families into our program. And we, in doing the work that we do, will be able to also help you reach the goals that you want to be reaching. And so really thinking about what are those shared risk and protective factors, whose mission is aligning with yours, and then just what kind of skills that you need. Do you need folks that are good at doing the data stuff? I am not a data person. And so having someone on a team when I'm doing this that's really good at knowing where to find it and finding it and how to explain it and interpret it, always somebody that I want to have on my team. So I thought it would be fun to try again something a little more interactive. And what I am going to, we're not actually going to have you annotate on this one. I'm going to try to do this in real time. What I would love for you to do is to share in the chat what kind of resources, skills, or data do you think you need to do the work that you want to do, to be meeting the goals that you've set out? Do you want to bring into your team to do this work? And so I threw a few on there, like I want to have a member of my staff on this team because I want to hear the perspective of someone that's actually doing the work. I know I want to increase access to healthy foods. And so I want to have somebody who has access to locally grown food. And so I'm going to encourage all of you in the chat to go ahead. I'm sorry, moving things around on my screen as I'm talking. I'm going to encourage all of you to share in the chat, and Bianca is going to read them out, and I am going to capture them on our little bingo sheet. So Bianca,
right.
Go for it.
Let me know when you're ready, Claire Grace.
Okay, go for it.
All right, we already have some good ones in the chat. Local businesses.
Great.
Mental health staff.
Okay, local business, mental health staff.
Passionate, energetic staff.
Great. Whoever shared that, I would love if you would add, is there something specific that folks are passionate and energetic about that would be helpful to add to your table? Like, for example, we were on another project and just talking about using quality improvement processes. And I have found in my career that there are some people that just love and eat and think and breathe quality improvement, and they know all the acronyms and how to do it. And so someone who's passionate about quality improvement would probably be an amazing person to have at the table. So whoever shared that, maybe if there's something specific also that you think would be helpful to have. Okay, and go ahead. I'm Bianca. I'm seeing school nurses. I'm sorry so I'm going to put that. And then what else have we got?
Sure. I'm seeing also a lot of nutrition. So whether it be a nutritionist, nutrition expert,
Ooh,
access to nutritional information. I'm also
great.
seeing a lot of great information, a lot of folks talking about making sure that you have school and school leadership support, whether it is school counselors, PE teachers, social workers. So really making sure that you are collaborating with schools and school leadership.
Together.
We also have some folks who are saying, which I totally agree with, connect with the community-based organization. Connecting and making those partnerships is incredibly important, whether it is with helping create a school garden, whether it is helping with the nutritional aspect. So definitely want to make sure, or whether it's having performance arts coming into the school for that physical activity. So that's incredibly important. One more that's also essential, having that youth voice. We got to make sure that we're listening to our young people. So thank you to folks who are saying youth voice.
Awesome. Keep them coming.
I also see a really good one, which is research and accountability. And I think a big part of that is also just making sure like there's a team that's supporting getting that information, whether it's evidence-based or evidence-informed information, that technical assistance support. So that's what I believe research and accountability means, but feel free to speak up on that if you put that in there. We also see some really good quotes, suggestions. We have land grant university extension agents. We also see, if if you are able to participate or collaborate with faith-based organizations, I think that's a really good one as well. If you know your community and you know that a faith-based organization in your community has a positive reputation and is able to provide some insight and support and resources, go for it. We always, youth to educator pathways, absolutely. And so I'm going to expand on that a little bit, Melina from Texas, and please feel free if you are able to unmute and correct me if I'm wrong, but youth to educator pathways could also mean, to me, could also mean making sure that you have resources for going beyond out of school. And also making sure that you are having workforce resources. So maybe that could be a separate one, Claire Grace, which would making sure that you are connecting with your staff and ensuring that they are also receiving professional development. Please let me know if I'm off. Melina,
Things are great. Keep them coming.
No, you totally nailed it. Thank you for
Keep them
sharing that.
coming. I also saw earlier the one that I would like to put in there, sustainability. What's our plan for sustainability? How are we going to make sure that this, all the great work that we're doing is going to continue forward? And we also, I saw some also language around management, so money management, making sure.
Grant management, always. I always try to make sure too, like I'm not always the best at like the agendas and the minutes. And so like, do you need someone at your table that's just going to be able to like coordinate things, be the one that sends out the meeting invites or does all the logistics? This part's really thinking about like, what are those like skills that you want to have in addition to like all of these roles, which is super important, that you want to bring to your table when you're doing this work. So these are great. Keep going.
I'm also seeing purpose-driven and passionate staff. Purpose-driven and passionate staff.
Yeah, absolutely. So we have staff member on here. And then again, I would ask like, when you say purpose-driven and passionate, what is it specifically that you want to see people come to your table that they're passionate about? Is it, they're really passionate about healthy eating? Is it that they, is it a staff member that loves, being creative and thinking about how to get the kids outside, and, do different activities? Like, what is it specifically that you want to make sure that you have around your table that folks are excited and passionate about, and that voice that they bring? I also, thinking of like, what are the voices that you want around the table? Who are the populations in your community that you really want to make sure that voice is represented in your thinking about assessment, in your planning? And so, do you have representation around your table of the different cultures that are represented in your community? Are you, somewhat, if again, Nadia was talking about things like in your community, thinking about, transportation, or how your community's been impacted by different things that happen. And so who are those people in your community that might be able, again, either as part of your core team or as part of your partners, help you to think about how to remove some of those barriers as you're planning a program? I mean, it's amazing to plan, a family night, but then who can help you kind of think about, how are we going to get people here? Are we going to need childcare? What's the timing of when we want to hold this to make sure that works for the, folks in our community? And so, great. I see some Snap. Ed, sorry, I'm cheating again and looking at the chat directly. So
No
I was also worried that I was not going to be able to read the chat and type at the same time. So we've got Snap education folks. What else?
Just working with other child care centers and orgs.
Okay.
All right. I think we need 2 more.
Yep. Just a couple more would be great.
All right.
I really want to say,
Please, Nadia. Yeah.
just shout out the child centers and how to collaborate with them. I think there's ample opportunity, right? The feeders, right? Children who
What
may
just
be coming
happened?
to you.
Sorry.
The annotation got cleared
Oh, no.
accidentally,
I
Claire
don't
Grace, so
know who did that or how that
I don't know
I didn't touch
happened.
it.
it's okay. We can
Okay.
rebuild as you're talking, Nadia.
That's fine. Go ahead.
Yeah, no, I just wanted to lift up the collaborating with childcare centers, because again, right, with the pipeline coming your way, how do you ensure really good communication with those staff members about understanding sort of what they're seeing, validating perhaps what you're seeing, what's presenting in your space? The other piece is a great way to collaborate on professional development. Someone said, hey, I need passionate, committed staff. A lot of that happens when you're also nurturing that, when you're growing that, right? It's how you create, continued education in your program. Staff certainly feel empowered and they feel more invested. So thanks for those 2 comments. I just wanted to really lift those up.
Awesome. Okay. So Kate and I are trying to repopulate this. My apologies. Community-based. Okay. Oh, I think we got that. Okay. What are we missing here? Let's, Bianca, what's missing from the chat that we had already?
So again, wanting to make sure that we are, I was trying to help you too. Putting some of
I'm just trying to think of what the list
youth to educator pathways, youth to educator pathways we have.
Yeah.
We also have collaborating with faith, if your funding allows, for faith-based organizations. We also have, let's see,
sorry.
making sure that we have research and accountability.
That was, yep.
I'll type that in now.
I got it.
Okay, great.
Thank you.
Community wellness as well. So community wellness liaisons.
Yeah. Oh, state health departments and departments of education. That's a great one.
Wonderful, wonderful. I think we're almost there.
All right. What else we got here? Let's see.
Let's see.
I'm going to throw in that I think there's, thinking too about sometimes, having someone who's really good at, I'm going to put like social media / communication. But I think that's often a great, grant management was the other one, somebody who, that's a special skill for how to, ensure, someone on your team or amongst your partners that's able to really reach out through social media or different forms of, communication to get out there what you're doing, to seek input in that way, I think can be helpful. And then someone who's good at grant management or grant or project management, I'm going to say. Great. All right. So now I think, do we have all the boxes full? It's hard for me to see with all the things going on my screen.
Oh, Grace, I actually put grant management down there.
Oh, okay. Okay.
But
Well, that's okay. Well, they're helpful to have, so we'll leave them on there twice. So what I invite you to do now, if this works the way it worked in my brain, is now, if all of you want to, again, open up your annotation tool. So if you kind of find your little black toolbar with all your tools and you click on that pencil that says annotate, and you go again to that stamper tool. So it looks like a check mark and you're just going to check it to find your stamper tool. I would love you to go through and mark out all of the ones that you already have at your table, kind of collaborate with regularly. And let's see if anyone in this first session already has a bingo. And there's a lot of people on the call. So this is going to be self-reported that I want you to do a little celebration reaction on your photo, or you can shout out in the chat if you've got a bingo. It's hard to tell because lots of people have the same icons. Like I said, if you know that you've got 5 in a row, 5 up and down, whatever it might be, feel free to put a little celebration icon on your video or to let us know in the chat if you've got a bingo. All right, I'm going to give one more minute. All right, it looks like they're slowing down. Anyone have a bingo? Anybody close? Oh, all right. Angela from Pennsylvania. Oh, and Katrina from Texas.
Has bingo as well.
Awesome.
Who else has bingo? And if you feel comfortable, Katrina and the other individual who said that they had bingo, if you would like to come off mute and share what that bingo is, what that looks like, we would love to hear it.
Mine was this is Katrina from Texas, sorry, was the youth, local business, free community. Oh, it's gone now.
It's okay. It's okay.
Oh, oh my gosh, I'm so sorry. Just tell us about some of the great partners that you have. Oh, are you still there?
Yeah, I'm still here. I'm sorry.
I'm so sorry.
So, I run the ACE program here at our school, and we are partnered with several, other than the school district. We've gotten chess boards for our chess club through grants, which someone helped me write. Our youth, our students are always coming and wanting to donate time because we are a pre-K through 12th grade school. So they share time in stuff with the littler kids.
Mm-hmm.
Our church here in town has partnered with us, and they have a clothing drive now where if we have students have anything go on, there's a place where they can go, or anyone in the community, if there's a fire or whatever, and they lose everything, there's a place for them to go get those resources.
Thank you so much for sharing that. Well, thanks everyone. And I think Kate made a note that we will kind of go back and grab all of those for folks. I'm just going to turn this off on my end. So now we want to also give a few minutes for all of you to continue to kind of think out loud about this together. And so we're going to put everybody in breakouts in groups of 4 or 5 for 5 minutes. And just take some time in your breakout group to talk about what is the capacity that you already have when you really think about implementing the HEPA standards. When you're thinking about, I want to, you know, pull a group of folks together to really help us think about what are we already doing well? What do we want to be able to do? Let's create a plan to make it happen. Who are the folks that you want to really help walk with you through that work? And so what capacity do you already have to do that? And then what skills or people or roles do you think it would be really helpful to add? And so Anna is going to put us into breakouts, and you will have 5 minutes. All right, everybody, welcome back from your breakouts. We'll just give everybody a minute to pop back in here. Anybody want to share, either unmute and share or share in the chat, like an aha moment or a thought, you know, something that you might like to share that came up in your breakout group? Tanya, I'm not sure if you unmuted because you want to share something or nope. Didn't mean to put you on the spot. Let's see. And oh, no worries, no worries. Anybody want to unmute and share what you talked about or share it in the chat?
Our group kind of talked a little bit about this is new for everyone that was in the group. So we were just chatting about how we're here to kind of learn and understand a little bit better. And then, you know, just shared a little bit about each of our programs and what we're doing. And then, you know, chatted about the big issue on everyone's mind, which is like staffing, especially when it's out of school time, right? An extended day, and being able to find like good partners to get those. So we talked about like partnering with like universities for some of their education students or other types of students. And that can have its challenges as well, because they have classes some afternoons and we're after school, you know, and so that we were just kind of chatting about that.
Awesome. I am always a big believer. I love to give a prompt for a breakout, but I'm always a big believer that whatever ends up sort of becoming the most helpful conversation for the folks that are putting their heads together at that time is like the best thing. And I'm glad it sounds like in just a few minutes, you all talked about a lot. That's awesome. Thank you for sharing that. Well, I'm going to go ahead. Please feel free to keep sharing in the chat. I'm going to go ahead and pull my screen back up. And move into the next step of kind of this whole process. So you're looking at the assessment tools beforehand just to get an idea. You're going to pull your team together. And then the next step is to go ahead and go through those two assessments that I showed at the beginning. And we're going to take a closer look at in just a few minutes. But I just wanted to also, you know, put out there that we really feel, you know, it feels like, oh, two, you know, different assessments, but we really feel like completing those two assessments in partnership together really helps keep equity centered and helps you to really like infuse that through each of your steps and think about those considerations throughout all of the things, the decision-making points that you are making. And so I just wanted to kind of give you a quick peek at what they look like. This is NAA's HEPA self-assessment tool, and this is the National Center for After School and Summer Enrichment, also known as NCASE. This is their health equity planning, out of school time equity planning checklist. And so you'll see in both of these, it kind of gives you an opportunity to think about, you know, are we not doing this at all? Are we doing it? You know, what are the, you know, what are the things that we might need to start thinking about if this was something that we wanted to implement? And they just really give you an idea with that team that you've pulled together to go through these and to think about both where you might want to celebrate. You know, this is hard work there. I mean, and people have mentioned some of those things today, you know, challenges with staffing and things that are happening in communities. And you know, we are always aspirational and wanting to, you know, pull more things in and wanting to make sure, you know, when we think about the HEPA standards, there's a lot of standards, and we would love, I'm sure, to be able to do all of them all the time in our programs. But we have to start where we're at. And the first place to start is to start by celebrating what you're already doing well. Take some time to really acknowledge the work and the partnership and the time and the commitment that's gone into doing the things that your assessment shows that you're already doing well. And then you have the opportunity to look for where you might be able to add some opportunities for improvement or innovation. So as you're going through those assessments, one of the things that we created in our assessment to action guide is a template for all of these kind of questions and considerations as you go through and you think, okay, we know what we're already doing well, and now we see all of these areas where we're not quite there yet, or maybe we haven't even started thinking about this yet. And you're ready to decide which ones you're going to choose first to work on. And so we just wanted to offer you some questions that you could use to think through each of those strategies. And so do you have the needed capacity or resources already for this? And if you don't, does it feel reasonable that in the time frame you're looking at, and so say you want to create a plan for the next year, is it possible that you could pull in the resources or capacity to implement that standard or that strategy in the next year? Or does that one really feel out of reach and you might want to be doing some work on capacity building for it, but it doesn't seem likely that you really are going to be successful in implementing it? Maybe that's not one that you're going to end up wanting to choose to focus on right at this moment. What are the potential barriers to implementing each of the standards that you've identified you could potentially choose? And again, can you overcome them? So what are, and again, this is where having broad and diverse representation on your team and around your table can be really helpful, because everybody at the table putting their heads together to say, this sounds really great. What might make it challenging for our program to do this? And how might we overcome those? Will this strategy be a good cultural fit for your community? And what might the equity considerations be? Again, is there something that might end up being a barrier in the way that we're thinking about implementing this if not everyone speaks English or reads English? Or how are we going to make sure that people have transportation to get to this program? Is cost going to be a barrier? If parents that are of the youth that we're serving in our program are working multiple jobs, how do we think about how to really make sure that they're going to be engaged in these strategies, and how do we do that in a way that is workable for them? And then, again, I really always try to think about sustainability from the beginning, from right when you first get those grant dollars, or right when you're starting to plan an initiative. If we're going to do something, how can we be building it from the beginning to make it more likely it will be able to be sustained? So is there a partner that we might want to bring in early on to really be bought into this strategy and why it's important and why we think this is a really good fit for the community and for our program? And if we can bring them in early, is it likely that they maybe will then make a commitment to be able to continue sustaining it if we no longer have the funding or the staffing to support it? What kinds of things would we need to be able to sustain this? If you're thinking about things like policy changes that you've identified that you want to make, often they take a lot of effort on the front end to create and to implement and to train people on them, but they do still take work. You still need to make sure that someone is ensuring that new people are being trained on it, or that it's being that it's really being implemented with fidelity, and that those things are still happening. And so how can you ensure that you're planning those things in as you're doing this work to make sure that things will potentially be sustainable in the future? And so I created this one just so we would have an example to look at. And so, for example, if you've gone through all those assessments and the standard or priority that you've decided that one of the ones that you're considering implementing is to include a fruit or vegetable with every snack or meal. And so you're sitting with your folks at the table. And so you've got a parent, and you've maybe got a youth and a staff member, and you've got somebody you know, from the local conservation board. So you've got your folks at the table looking at this with you together, and you say, okay, would we have the capacity and resources to include a fruit or a vegetable with every snack or meal that we serve in our program? And so maybe the decision is, well, we don't currently have the funding to do that, but we know that the Community Foundation has some resources for that. And we know that our conservation board is going to be really supportive of it. And we're going to, you know, we think that we could create a partnership with a local business, whatever it might be. So we don't have it, but we do think it's reasonable that we could get the needed resources and funding to make this happen. So we're going to kind of hold that there. What do we think the potential barriers might be? You know, again, fiscal resources, training our staff, you know, we might have this food available, but a potential barrier might be that the staff don't feel confident in encouraging kids to try new foods, or they maybe don't have a lot of tools in their toolbox just yet for some creative ideas to get kids into this. So, you know, we could provide some training around doing taste tests and food reviews, and having kids share food from different cultural backgrounds. And so some potential barriers might be around staff really buying into this. And we just want to, you know, make note of that and be able to think, if we're going to choose this one, what some of those potential ways that we can try some things out would be. You know, is this a good cultural fit? We think it could be a good cultural fit if we seek input on fruits and vegetables that are familiar to the cultural makeup of our youth. If we, you know, start this initiative out by providing every day a whole bunch of fruits and vegetables that the youth in our program are just not familiar with, we're concerned that it might be harder to really get this going. And so, you know, we want to be really thoughtful as we're doing it about what are some foods that might be more familiar that we can start with, and then we can build in some additional things through some taste testing and things like that. And yeah, this fits our program culture great. We love to have everybody come together for a snack. We do that every day. You know, it's a communal time that we use to talk to kids about their day and things like that. And so that feels like a great fit. What are some of the equity considerations? Well, we know in general that our area, you know, I think about that slide that we had up for the community health needs assessment section that was talking about how they were looking at the data around food insecurity in their area. This is kind of an example of where that connection might be. Like, we know in our area, because we've looked at the data, there is really a lack of access to fresh fruits and vegetables. And that impacts about a third of the families that we serve. And so we feel like this is really important for us, not only to be able to provide a fresh fruit or vegetable for snack in our program, but we also even want to think about how do we expand that and maybe have the ability to share some of those back with parents, or to share some ideas for how to get creative with being able to offer fruits and vegetables in an area where procuring them is really difficult. And then sustainability. If we are going to implement this, you know, what are some of the things that we could do that would make this sustainable? And so as we're going through this process, maybe we're going to want to think about how we can share some of these stories with our funders to demonstrate when things have been successful, to share additional funding. We're going to think about how we're going to kind of capture some of those moments in advance so that we're able to leverage that later. And so that was a lot. And during our next session, we are going to talk about those kind of next two steps that we've pulled together in the assessment to action guide, as far as how you then, you know, choose the strategies that you want to work on, and think about, okay, we've identified that we think there's a couple of barriers, but we want to try out some things for how we're going to anticipate them. We're going to choose, you know, we're going to decide which ones might be kind of low-hanging fruit that we think we could really easily implement, and which ones we think might take a little more work, but we really want to stretch and make them work. And so, and then taking all of that and putting it into an action plan. Here's what we're going to do, when we're going to do it, here's who's going to do it, here's how we're going to know it happened. And so we're going to talk about all of those things at our next session. And so I wanted to pause here just for a couple minutes to see if you have any questions about all of that before I share our program spotlight, that I hope you'll stick around for our program spotlight and just a couple things to close the meeting. But just to pause to see if anybody wants to unmute or share in the chat any questions that you have. I'm going to pull up my chat so I can actually see them.
Claire Grace, there was one comment
ma'am.
from Sarah
Great.
that was not a question, but just I wanted to call it out because it was
Please.
a kind of a supporting of a comment about universities, and that often medical, nursing, public health schools have a service component, and that they can help with the short-term or long-term projects, like a needs assessment, to help add capacity building. So I thought that was such a good comment that follows up what you were just sharing that Sarah had posted.
Yeah, thank you so much. Yeah, I've often found too, like that whole like data piece, the pulling in, if you've got like a local college or university, that can be a really helpful area to get some expertise. Absolutely. Anyone else? I mean, I have a question about anything that we've talked about, an aha moment, a comment. It's a lot. I know. Which is why we wanted to break it down into small, I think really small, manageable pieces. Well, while folks are still thinking, I think I'm going to go ahead and go to the next slide. I am so excited. We always want, when we pull people together, for a virtual institute, for our, communities of practice, we really want to share, folks that are doing the work out there in the field, and ways that they found successes, barriers that they've overcome, things that, you can take and pick up and utilize. And so I'm really excited I had the opportunity. They weren't able to be here live because they're busy with their after school program this afternoon, but I had the opportunity to talk with the staff supporting the Gardenator program, which is at College Street Elementary in Tennessee. Their after school program, the Journey program, is part of the Tennessee Healthy After School Pledge. We're going to put the link to that in the chat. It's a program that recognizes out of school sites across the state, but others can also go on their website and access their resources. They have amazing resources. But they recognize those across their state that are committed to advancing health and wellness of their students. Sites participating in the pledge commit to upholding the 3 pledge principles, which are prioritizing health promotion goals, providing safe and supporting environments, and promoting equity and programming. And so in the video, you're going to hear from their site coordinator, Kim McAfee, a staff member, Tammy Gibson, and their partner, Nina Hansen, who works for the Coffee County Conservation District. And I'm going to mute myself first.
I am Nina Hansen. I actually work for the Conservation Board here in our county, Coffee County. We're in Tennessee. And I'm the only one that's not employed at College Street, but I work with these ladies in their after school program.
Hi, I'm Tammy Gibson. I'm the lead coordinator for the Journeys program with the Garden Club, and work with Miss Nina on the hands-on of the garden part every day.
I'm Kim McAfee. I work for Manchester City Schools during the day as well as the after schools program in the afternoon. I'm the head site coordinator, and we're glad to be here.
So tell me a little bit more about how then you use that gardening program to kind of touch on all of these things, healthy eating and physical activity, getting the kids out and moving. It sounds like when I hear you talk about it, you kind of touch all these different things with the program. I'd love to hear a little bit more about that.
Yeah, when I do a lesson plan, I try to incorporate everything from reading to math, science. I want the kids to be outside moving. If they have their hands in the dirt, that's even better. And Nina fosters that with her lessons for soil conservation, water conservation, indigenous plants, pollinating plants, all those things are covered. So these kids are getting everything from one activity. And they're also growing their own vegetables, harvesting them, cooking them, and eating them. and trying new things that they wouldn't normally have tried.
So tell me a little bit more about that, getting them to try new things. What do you do with the things that they grow?
So our 3 little garden beds did so well that we were able to send them home with food. And so like that was our hope, that we could at least get some of these healthy foods in their home and get them to try it. And Kim talked to me about maybe doing some cooking classes so that everybody would know how to prepare these as well. So
Here's our cooking classes we did.
yeah, so we were able to do how many? 5 of them?
Mm-hmm.
Some were salads, and then some had some actual cooking. The kids wrote the recipes down for some of the recipes. They sat there, and so that was making them pay attention and write each step to take home to their families. And then the garden kept giving. So then we were able to share it here at College Street in the after school program, and then the garden kept giving. So then we were able to share it outside of our club, and we ended up giving, I think, over 180 healthy snacks for the kids from 3 little garden beds. So all of these things, all of these lessons that pertain to our outside area, which now we're kind of calling an outdoor classroom because we've kind of expanded from just the gardening. More to your question, I guess all of those things together, spending time out there, doing all of this, understanding how for everything that happens under the ground and over the ground works together, it makes them want to try the foods. It's like all of these lessons really point them toward, I guess, maybe a bit of a passion, and they are really excited about eating the healthy foods that they've grown, and they're proud of what they've produced.
And so just real briefly here at the end, like, if someone who's, watching is interested in, exploring doing something like this, or just looking how to maybe get a local connection to do some more sort of gardening or outdoor things, do you have any suggestions for them?
What we figure out what's needed.
Well, we reached out to our community partners, a local building supply company and different places in town that sold flowers and mulch and dirt and soil, and we got quite a few donations from about 8 different businesses through town. Even Paint donated to paint our newest bed, our native pollinator plant bed, and everybody's been very, very appreciative and very helpful to us.
Yes, and I would suggest reaching out to your local extension service or conservation board. Most counties have both of those things, and at the least they could kind of point you in the right direction and get you started, and help you out if you have technical questions about soil, what amenities you might need. They could help you out.
All right. I really enjoyed talking to them. Their program was really excited how they kind of revived these garden beds that they had, and have gotten the kids so excited and interested in growing the food and trying new foods. And I know we've put some links in the chat if you're interested in finding out more about the Tennessee After School Pledge, or a great article that was written for their local paper about their program. So now I'm going to hand it over to Bianca to kind of bring us through the next few pieces as we come toward the end here.
Thank you so much, Claire Grace. And I also was very impressed by the video, and I really appreciated that the group said, hey, we can't actually be there physically, but we would love to still, showcase our work. So thank you so much for sharing that recording. So one of the things that I would like for folks to do at this time is really take some time to really think about our commitment to action. Take some time to think and possibly write it down. I'm old school, so I like to have a handy dandy notebook. But some folks can use a Post-it or even just open up a Word doc, and really think about, what are some of the things that you will do between now and our next session, and what do you want to learn more about? Feel free to, like I said, put this somewhere where you can see it again, remember it, and really take this time to also reflect. And last but not least, also feel free to share what are some of the things that you would like to do? One of the great things about the chat feature is that we're able to make some connections. So there might be some things that you would like to know more about, and someone else may want to know the exact same thing, and we can make that connection. Or there may be some things that you'll be committing to, and someone may have experience in that. So again, feel free to put it in the chat, but also make sure to write it down yourself and put it, like I said, either in a notebook, a Post-it, or type it out in one of your personal documents. Because again, we want to make sure that the end goal of this virtual institute is to ensure that everyone here has the resources to create that action plan that we want to focus on for our next session. So again, I encourage folks to take some time to reflect and really think about what you would like to have in your, what you would like to discuss in our next session, and what you plan on doing between now and the time that we meet again. Okay. Well, to be respectful of time and space, and folks, Zoom, I call it the Zoomies. It's getting to a point where it's like all the meetings are starting to blur together. So thank you for those of you all who were able to do that reflection, but just weren't able to put it in the chat. But no worries. Next time, we hope to see you for our next session, which is going to be October 10th from 2 to 3:30 p.m. Eastern. And this session is really where we're going to get our hands dirty. This is where we are going to be focusing on what are some challenges that we are experiencing within OST, solutions tests, and then again, that action plan, because we want to make sure that everyone here is set up for success. Please feel free to share your feedback with us via survey. That link will be provided in the chat if it has not already been. And again, we also want to encourage you to utilize our partners in AA. To be specific, we have a fantastic page on their website, and that site link will be shared either in the chat or within the follow-up communication. So again, please feel free to share your feedback with us. We'd love to hear your thoughts, questions, comments, or concerns within our survey evaluations, because we want to make sure that we are providing you with as much high quality information as possible. Claire Grace, any last words? Kate, any last words?
No, I just want to thank everybody for being here and for being so engaged. And I really hope people will join us for session 2. It's the same link that you joined with today, and we'll kind of send out a reminder to folks right beforehand. I know I always appreciate that, because then it's like in the top of my email box, but nothing to, you don't need to register additionally or anything. Just hop back on and join us for session 2.
All right. Thank you all so much. We look forward to seeing you next time. Don't forget to do that survey. We need your feedback. We appreciate it, and we appreciate you. Thank you so much for your time. Thank you all. Thank you, Julia. We appreciate you. Thank you, Jimmy. Thank you, Angel. Hey, Angel. Good to see you. Nice. Kristen, nice. SW, Washington, thank you so much for joining us.
Thanks all. We can go ahead and close out the room, Anna. Thanks, everybody. We'll see you in October.